Dr. Catharine Paulus is an infectious disease physician at Penn State Hershey Medical Center, and she's working on an experimental drug for treating COVID-19. Welcome to our program.
Thanks for having me.
Doctor, first, tell us about your background.
So I came to Hershey Medical Center about a year and a half ago. I see primarily stem cell transplant patients that have very serious infections. Prior to coming here, I worked for the National Institutes of Health, and my focus was on influenza.
How did Hershey Med Center get selected for doing this clinical trial?
So this clinical trial is sponsored by the National Institute of Allergy and Infectious Disease, and they look for sites all over the country that have different populations to be a part of the trial. So we were lucky enough here at Hershey Medical Center to be selected as a site for the trial.
So tell us about this experimental drug you're working with, and pronounce it slowly. It'll be the first time a lot of our viewers will have heard this.
The drug's name is Remdesivir. It's an antiviral medication that was developed by Gilead, and it was originally developed for the Ebola virus. And why that's important is that many of these viruses are in a broad category called RNA viruses. So this antiviral can actually stop some of these RNA viruses from replicating. So someone might get infected, but maybe they don't replicate virus as well, so they don't get as sick. So that medication has never been proven to work for COVID-19, and that's what this trial is designed to do, to show whether it works or not to treat patients with this very serious disease.
Now, I understand that animal tests have shown benefits in treating diseases that are similar to COVID-19. Tell us about that.
You're absolutely correct. There are two related coronaviruses, SARS and MERS, and in animal models, this drug seems to work well against them. Now, that's in animals and it's against only related viruses, but we're hopeful that this might be effective against the virus SARS-CoV-2 that causes COVID-19.
So how did Remdesivir get approved in the first place for experimentation?
Well, it doesn't get approved, so not in the typical sense that you would think about through the FDA. So these are the types of trials that actually help with those approval processes. So the first step is to test this medication against what we call a placebo. So patients are enrolled into the trial and they receive either Remdesivir or placebo. And we don't know which ones they get. That's to keep any bias out of the trial. So I don't know what the patient gets, and neither do they. And then all the data will be collected and analyzed by the National Institute of Allergy and Infectious Diseases. And then hopefully we'll know whether this drug works or not.
How sick are the patients that are being treated with this drug?
The patients that are enrolled into the trial that get either the Remdesivir or the placebo are hospitalized patients only. So they have to be sick enough to be in the hospital.
And about how many patients are included in the trial in order to make the results valid?
So there are numerous patients across the United States and even internationally that have been enrolled. Over 900 patients, I believe, last that I saw. We've enrolled 6 patients here at Hershey Medical Center as our part of the trial. And actually the trial is ending, so the data is going to be analyzed in the next couple of weeks by the National Institute of Allergy and Infectious Diseases.
Now tell us about the basics as far as taking this drug is concerned. How does the patient take this drug?
It's given through an IV, so it's an infusion through an IV in the arm or wherever you have the IV placed.
Are you aware of any significant side effects from this drug at this point?
So we don't know whether patients in our trial are getting the drug, but based on other data in people, we know that it can cause some GI upset, nausea, decreased appetite. And then the other thing that we watch very closely is for liver function test abnormalities. Again, we don't know in our specific group of patients here, but those are the side effects that have been described in the past with this medication.
So at this point, doctor, do you have to wait for the other testing sites to complete their work as well? I understand there's a whole bunch of other sites testing this drug as well.
So I believe every site has completed, and now the data is going to be analyzed. So we're hoping that we will have an answer one way or the other about this medication.
And how soon will the data be analyzed?
It'd be a question for the National Institutes of Allergy and Infectious Disease. I'm hoping that we'll know soon. I think we all want the answer to this question.
So how many other sites are testing this drug? I understand Hershey Medical Center is just one of many places.
I can get you those numbers, but there are quite a few sites around the country. I believe we're the only one in central Pennsylvania, but there are other sites in Pennsylvania as well as around the country and even internationally.
Now, I know you're still waiting for the data to come back on this, doctor, but have you been able to learn anything in recent weeks about this drug that you'd like to share with us?
We really don't have any of that information. That's why the trial is designed this way. Actually, it's to keep us from having that information because we want to be unbiased. We want to truly understand whether this drug is beneficial or not.
Assuming there is success with Remdesivir, how soon could the public be able to get this drug?
Well, I think that's a question for Gilead and for the FDA, but I would assume that both of them would be working very closely in conjunction to get this available to people if it looked like a good treatment option.
And how important is that stamp of approval from the FDA, and how long might it take?
I think they've been remarkably quick about doing things in the setting of a pandemic, and so I think they would move quickly if it looked like the data supported that. I think the thing to caution people about is that we don't know that any of these drugs work, and that's why there is a clinical trial. It's so important to actually demonstrate that they work and that they're safe for patients.
Are there other drugs out there, doctor, that show the same promise as Remdesivir?
There are numerous drugs being studied in clinical trials right now, and I think upcoming weeks and months will tell us whether these medications work or not.
All right, Dr. Catharine Paulus, infectious disease physician at Penn State Hershey Medical Center. Thank you very much for your time.
Thank you for having me.
Dave Smith is the executive director of the Pennsylvania Dairymen's Association. Welcome, Dave, to our program.
Hi, Larry. Thanks for inviting me on.
How big a contribution does the dairy industry make here in Pennsylvania to our economy?
Well, the dairy industry is part of agriculture, but it's a huge impact on Pennsylvania all around. Actually, the Pennsylvania dairy industry impacts Pennsylvania to the tune of about $12 billion in economic activity. And Pennsylvania, and it's one of the largest sectors of agriculture also. So dairy is a really big deal here in Pennsylvania, has been for a long time, and will continue to be, but also has really great impact on our economies here in Pennsylvania.
So Dave, tell me about the Dairymen's Association and what your members expect.
Well, the Dairymen's Association is a nonprofit organization where we have some specific goals in mind as far as raising some money through sales of milkshakes at the Pennsylvania Farm Show, but also returning that money back into the industry and agriculture in the areas of support in scholarships and educational activities, and also some consumer education also.
Now, Dave, milk is a perishable. Just how much pressure is there to process it and get it on the shelf?
Well, there's a system in place, and there is pressure to get milk processed and on the shelf. Any milk on the shelf today normally is there within 2 days of being harvested from the cow. So it's a very quick process. That means it has to be transported from the farm to the processing facility and then to the stores. So we have a system in place where milk is very fresh and from local sources most of the time.
So how is demand for milk affected by the outbreak of COVID-19?
The demand for milk has changed dramatically. We have a massive shift in the supply chain over the last month, and I can explain that a little further. Before we started into the COVID-19 situation, our milk was distributed through a number of different sources and areas. One of the difficulties that we've reached is about 50% of the milk and the dairy products has been consumed outside of the home. And when I say that, I mean through institutional buying, hospitals, schools, many different restaurants and places like that. So with the lockdown and the shutdown of COVID-19, it has diminished the amount of dairy needed to consumers because of so many people not being out in their normal environments.
When the governor sent students home early, 2 months early, just how much milk was there at that point that needed to be processed?
Well, obviously, all that milk that would have gone into the school channels and all those other channels needed to be diverted. Some very, very challenging situations have arisen and continue. There have been some very positive steps made to redistribute and redirect some of those products over the last couple of weeks, but it has been very challenging for a lot of different people that are working really hard.
Now, my understanding is that some raw milk had to be disposed of or dumped because you simply couldn't get it processed in time. Tell me about that.
Well, I will. As I mentioned earlier, 50% of the milk dairy products were consumed outside of the home. With such a short turnover and change that we had with the COVID-19 situation, that milk didn't have a home. So when you think about all the institutional buying that like I mentioned earlier, that use dairy products, and I'm not just talking about fluid milk, I'm talking about cheeses and yogurts and anything related to dairy, even ice creams and things like that, that would have been consumed outside of the home. The markets dried up for those products. Mm-hmm. So it's just a very challenging situation where some milk we had a bottleneck, and some mm-hmm. milk needed to be disposed of. And it was, and it's been very disheartening to our dairy farmers in Pennsylvania to do that and see that happen, just as everybody else, that you don't want to see a good nutritional product get disposed of. But we just had a situation where processing plants, we have processing plants built for fluid consumption that continue to process and push your product through. Mm-hmm. But when we had a close down like that, and the supply and the demand for those products diminished in other areas, some of those areas packaged dairy products in much larger volumes than people use in the stores. When we think of institutional buying, there's restaurants and places like that, Larry, that may buy butter in 20-pound blocks. They may buy other products in very large volumes. So we don't have the luxury in our processing and supply chain to shift on a dime to change the packaging to products that we can use in a home use. So as you can see, it just made for extremely challenging and difficult situations for many, many people.
So Dave, it's a shame, of course, to dump all that perfectly good milk. Was there no alternative to somehow get it processed somewhere else and even give it away to needy families?
Well, that has been done, Larry, and that's one of the very positive things that we are seeing going on, is that our farmers, are continuing to work, every day to care for their cattle and their livestock and just maintain, the systems that they have on their farms. And they have been very intentional about trying to see if they can go into the charitable food system. The challenge there, Larry, has been that, as I mentioned earlier, the processing plants that we have are pretty much full most of the time, making the fluid milk and the gallon jugs and things like that. Mm-hmm. So what we had was a situation where there was no capacity of those plants to add on more production to go into the charitable system. Mm-hmm. Now, that being said, there has been a large and sizable amount of dairy products being moved into the charitable food system, which is a very, very positive thing, because we have a lot of unemployed people, and I know there's a lot of other people in need. So, and our dairy farmers and farmers in general, are very pleased to see that happen. So some of it is the supply chain and the production facilities. I mentioned, they run at capacity, but I also want to point out that with the COVID-19 situation, we have many processing plants and production facilities that are operating at low employee capacity. In other words, some of them may be furlonged, or there may be some people that are home due to illness too. Mm-hmm. So production has been limited on the processing side.
Mm-hmm. And the demand, Dave, has been shifted away from schools and restaurants to the home. So to what degree does that compensate? I suppose you'd have to produce a different package that is better suited to the home. Talk about that.
Well, people, what I would like to do is also encourage people to support their local economies and their farmers is mm-hmm. to maybe increase their dairy consumption at home. I would encourage people to choose fluid whole milk over some juices, sugar drinks, and help provide their children with some nourishment that they have in school and maybe sometimes they don't have at home. As far as shift in packaging, I'm not sure that's going to be a possibility for our home use too much, but there have been some shifts to help out in that, and that's mm-hmm. encouraging too.
Mm-hmm. Yeah, and what I'm talking about is, for example, in schools, they like those little half-pint packages, right?
Yes. I think that there are some plants that are increasing their production. It's a distribution system to get that into the homes. I think that there's a lot of children and people that do like the pints or the half pints, and that's up to the consumer to pick those up at the stores if they can get them.
So, Dave, last question. Talk about how farmers' profits have been affected by the COVID-19 outbreak and what the Department of Agriculture might do to help them.
Sure. Larry, the COVID-19 situation has been extremely impactful on the dairy and agriculture industries in a negative way. As soon as the levels of demand started to diminish for some of the products, the futures markets where pricing for dairy and other commodities is set dramatically decreased. So whereas a few months ago, I think some of our dairy farmers were optimistic that we had come out of a downturn, and we're very optimistic in the upcoming year when the COVID-19 situation hit and happened. We have forecasts now that the income to our dairy farms will be dramatically decreased. As far as what the Ag Department can do, they have been very responsive in many different ways. One of the largest things that I have seen that would be most impactful on our farms is the outreach to legislators and in Washington, D.C. and USDA to help. For one, many USDA has been asked if they can help supplement or help pay for some of that product that had to be disposed of when it was rediverted. Some other things that are going on is that Washington, D.C. is looking to help out some of these dairy farmers through the upcoming months with some help as far as some financing also.
All right, Dave Smith, Executive Director of the Pennsylvania Dairymen's Association. That's all the time we have. Thank you very much. Senator Jay Costa, Minority Leader, the governor has a color-coded system for reopening Pennsylvania. Can you explain the basics to us?
Well, basically, the governor's put forth a logical and thoughtful approach about how we're going to reopen and reintroduce different sectors into our Commonwealth's economy and doing it by regions, as we now know. Governor has broken the state up into 6 regions and is looking at the data and the information and looking at the advice of the healthcare professionals to determine where each region is with respect to our economy and how it's going to be impacted by the COVID-19 situation. Governor's put together 3 phases or 3 stages. We are all currently in the red stage, which means we're basically under a stay-at-home order with other life-sustaining type of entities being able to work, but yet doing it with social distancing and the mitigation factors in place. The next phase where folks hope to be able to move to would be the yellow phase, and they need to meet certain conditions before they're able to move there. One of them is 50 new cases on average over the course of the last 14 days. But as well as looking at the capacity of the healthcare delivery systems in those areas, and monitoring both of those things as they go forward. And then finally, there will be other factors that will go into a CMU-developed study, Larry, that would say whether or not this particular region or part of that particular region warrants being able to move from the red phase into the yellow phase to allow them to open businesses and the like. Again, all with the understanding that they would have to practice mitigation work that needs to be done, social distancing, et cetera. The masks, the gloves, the gowns, all those type of things will need to be part of the conversation and the company and an entity's ability to access that. Now, once they go through the yellow stage and the things progress and the numbers continue to drop in a pretty significant way, then folks could proceed into a green phase, and that would be essentially a reopening of an economy and allowing for, again, recommending the social distancing and mitigation factors.
So, Senator, progress on testing, how important is that for moving from one color phase to the next?
That really is extremely important as we go forward. And that'll be a major component to the conversation about moving from one phase to the next. The problem has been, up to this point, we've not necessarily had what I'll call the ingredients to be able to do a lot of the testing. As we heard from Dr. Rachel Levine on a number of occasions, we have the capacity to do it, but we don't necessarily have the appropriate level of ingredients. And we're trying and struggling and competing with other states and other regions, the Commonwealth and the country, to be able to acquire those type of things. And certainly a little disappointment coming at the federal level. There seems to be some misstatements or misunderstanding about the capacity to be able to deliver and help us in that regard. But testing is extremely important, and it's going to be one of the determining factors that's put into this study that I mentioned, or this formula that CMU has produced to be able to help us get to a place where we can determine who's going to move from red to yellow.
And Senator, when we eventually get to that green phase, that doesn't indicate a total return to normal, does it?
It does not. It means that things are going to be, folks, the economy will be back open, but expectations would be we would want to continue as much as possible maintaining the social distancing and the mask and the hand sanitizer and all that stuff that are an important part of the whole mitigation factor, as well as continuing to do the testing that needs to be done. The fear is that as we move from red to yellow, even to green, that we don't want to find ourselves in this position again 4 to 5 months from now. So we need to be thoughtful and need to be smart about how we progress from stage to stage. And that's why I really think the governor's approach and Dr. Levine's approach to this is appropriate. It's thoughtful, it's methodical, it reviews the data, looks at the data, and makes those health decisions based upon the data, which I think is important. How
firm is that May 8th open up date?
I don't know. I think it depends on the region. I think you might see some regions of the Commonwealth that may meet that criteria that I described earlier, likely to be the northwest and north central part of the Commonwealth. It looks like they meet those numbers. But again, there are other variables that go into a formula to help us get to that decision. At this point in time, that has not been made, but I think there's probably a decent chance that those two regions may open up. I can't speak to any other region of the state because I don't know. The numbers are going to drive that in many respects.
Republicans tried to get the governor to ease up on reopening businesses and their restrictions in general. What did you think of those efforts?
I just thought the efforts were not at the right time. They should allow the governor and the secretary to continue to make these thoughtful decisions, region by region, sector by sector, as we move forward. And that's precisely what's being done. I felt that was the more thoughtful approach. 2 weeks ago, when the Republicans were trying to ram through, for example, Senate Bill 613, it just wasn't the right time. And the data didn't reflect exactly what was being done and what was going on in our Commonwealth. I think now as we move forward, we're now 2 to 3 weeks removed from that exercise. I think we're in a better position to be able to begin to lay out a plan. And that's what the governor has only done. He's only laid out a plan about how we move from red phase to yellow phase to green phase. The numbers will dictate whether we need to backtrack off of that plan or not. But we know what we need to meet. We know what the indicators are. And as we move forward, the numbers and the number of cases and the amount of testing will tell us whether or not we've met those goals.
Senate Republicans complained that the governor left them out of the decision process. What do you think of those claims?
I don't necessarily think any political group of people should be involved in that conversation about what's best for the Commonwealth as it relates to the health, safety, and welfare. The governor declared an emergency. and he has the power to be able to make those determinations, those decisions based upon the data, based upon what health experts and safety experts tell us what's appropriate, and he had to make tough decisions. We all recognize and sympathize the frustration that many of our small businesses are dealing with, what our employees are dealing with, the frustration with the UC conversation. We hear that every day. Our heart goes out along those lines. But at the end of the day, it's what's in the best interest of the Commonwealth as a whole, and that's where we're at now. And we'll begin to proceed in a regional approach as we move forward, which I also think is appropriate.
Let's talk about legislation you're working on. I'm thinking of a bill that protects stimulus checks. First of all, about how much money is in the average stimulus check a Pennsylvanian will get?
And each individual is entitled to receive $1,200. If it's a married couple, they'll be receiving $2,400. In both instances, if they have children in the home, they'll get an additional $500. The legislation that we have put forth would prevent banks and other folks from garnishing those dollars. We understand that folks are struggling and unemployment has not been where we want it to be, but at the end of the day, they're making progress. But people need resources, and we don't, at this point in time, need these bill collectors or debt collectors or banks garnishing wages of those individuals or garnishing those stimulus checks of individuals who, when they receive them, will need them to be able to do things like buying their food, paying their medical bills, possibly purchasing or paying for their rent, etc. We need some time to allow them to get reacclimated into our economy, and then at that point in time, folks will be able to deal with the debt that they still owe.
So just to be clear, are creditors and debt collectors allowed to garnish funds under most circumstances?
I believe they are in some circumstances. They are working with their banks and other places. They go through the appropriate court proceedings. I think that's what we're trying to prevent, making that happen.
And you mentioned a minute ago what's being referred to as the unemployment compensation booster payment. I think you mentioned that. Anyway, that's an amount of $600 on top of the other funds we're talking about. Where did that come from, this unemployment compensation booster?
So many changes were made both at the state level with respect to our unemployment compensation law. We waived the work requirement because there's not many people working, so it was inappropriate to require folks to have to go try to find a job. Similarly, instead of waiting 7 days before you can collect, you collect on day one. And the third thing we did was we held employers harmless with respect to the rates that they would pay as it relates to their Pennsylvania unemployment compensation. The federal level, they made major changes as well. They provided, for example, a $600 stipend to everyone who's receiving unemployment compensation benefits for a period, I believe, of 8 weeks. That's a booster to their unemployment. In addition, they've allowed other folks to enjoy, typically those folks who are self-employed or 1099 or independent contractors and gig workers, allowed them the opportunity to collect unemployment as well, because they too have been forced out of our economy. So they're changed at the federal level. They're paying the $600, and we have our Pennsylvania unemployment compensation system in place as well.
Under your legislation, how long would debt collection be suspended?
I believe it's 60 days post the end of the declaration.
What other COVID-19 legislation are you working on, Senator?
Our caucus has put forth a number of measures, Larry. One of them would be, for example, not being able to terminate somebody or retaliation for not being able to or want to come to work in a COVID-19 situation. We have a lot of legislation centered around protecting our workers, our frontline workers in particular, to ensure that they have sufficient amount of PPE and making certain that they have the appropriate other equipment that's necessary for them to be able to do their work. We're also looking at things in the housing space and rental space to ensure that we're not going to be evicting folks. I know the court has taken steps. We want to go beyond that as well. The other thing is looking at making sure that at the state level, we are not taxing any of the money coming in, whether it be the stimulus check, whether it be $1,200, $2,400, or whatever comes in because you have kids, that won't be subject to Pennsylvania state taxes, as well as the additional dollars coming from the federal government. Those are just 3 or 4 of the things that we're working on right now. There's a whole bunch more that we believe are appropriate and necessary as well.
All right, that's all the time we have. Senator J. Costa, Minority Leader, thank you for your time.
Anytime, Larry. Thank you.